Assalamu alaikum students. Today I will tell you about the congestive heart failure, which is a topic included in the cardiovascular pharmacology. I will tell you about the pharmacotherapy of the congestive heart failure, which includes the inotropic drugs, vasodilators, diuretics, aldosterone antagonists, and the beta blockers. Drug used in heart failure are inotropics. Number second is vasodilators. Number third is the diuretics. Number fourth, aldosterone antagonist. And the number fifth is the beta blockers. Vasodilators. Now you can see that they increase the Dunkey efficiency. Okay. Vasodilators act like these. Okay. You can see that the donkey is happy because he have a wheels in his foot. So he don't need to have enough effort to do any work. You can see from these the vasodilators include the arteriolar vasodilators, which includes the hydralazine, minoxidil, nicorandil, the venodilators, which includes the nitrates, and the arteriolar and the venodilators, which includes the ACE inhibitors, angiotensin converting enzyme inhibitors, and the angiotensin receptor blockers. Vasodilators. The rationale for the use of oral vasodilator drugs in the pharmacotherapy of the congestive heart failure derived from the experience with the parenteral agents, phenethylamine and the nitroprusside in patients with severe heart failure and elevated systemic vascular resistance. Although a number of vasodilators may improve symptoms in heart failure, only the hydralazine isosorbide dinitrate combination and the antagonists of the renin-angiotensin system ACE inhibitors and the AT1 receptor blockers have been shown to improve the survival in prospective randomized trials. The renin-angiotensin system antagonist, which includes that the angiotensin 2 is a potent arterial vasoconstrictor and an important mediator of the sodium and water retention. In addition, angiotensin 2 potentiates neural catecholamine release, which promotes vascular hyperplasia and the pathologic myocardial hypertrophy and the stimulates myocyte death. Consequently, the antagonism of angiotensin 2 forms one of the important components in the heart failure management. Angiotensin converting enzyme inhibitors suppress angiotensin 2 and the aldosterone production, which in result decrease sympathetic nervous system activity and potentiate the effects of diuretics in heart failure. The angiotensin converting enzyme inhibitors are most potent arterial than venous dilators. The first orally active ACE inhibitors, angiotensin converting enzyme inhibitor is captopril capotein, which was introduced in 1977, and five other ACE inhibitors, which includes the enalapril, ramipril, lisinopril, quinapril, and the fosinopril, are currently approved for the FDA for the treatment of heart failure. The ACE inhibitors, angiotensin converting enzyme inhibitors, ends in April. There is a captopril capotein. There is a prescription in enalapril, and there is a prescription of the benzopril. You can see its action. It decreases the peripheral vascular resistance without increase the cardiac output, without increase the cardiac rate, and without increase the cardiac contractility. The ACE inhibitors effects are dizziness. You have feeling dizzy, orthostatic hypotension, GI distress, non-productive cough, and simply the headache. Renin-angiotensin system antagonist. Angiotensin receptor antagonist 2 can bind with high affinity to two distinct receptors termed the angiotensin type 1 and the angiotensin type 2, which means that there is a AT1 receptor and which means that there is a AT2 receptor. Losartan was the first imidazole AT1 receptor antagonist developed and is a selective competitive antagonist to angiotensin 2. Other AT1 receptor antagonists approved for the treatment of hypertension include the valsartan, irbesartan, candesartan, clexitil, telmisartan, and the iprosartan. Nitrovasodilators, which includes that the nitrile vasodilators have long been used in the treatment of heart failure and remain among the most widely used vasoactive medications in the clinical practice. These drugs relax vascular smooth muscle by supplying nitric oxide and thereby activating soluble guanylyl cyclase. Nitrovasodilators includes the organic nitrates. Organic nitrates are available in a number of formulations that include number first, rapid acting nitroglycerin tablets or spray for sublingual administration. Number 2 is the short acting oral agents such as isosorbide dinitrate. Number 3 is the long acting oral agents such as the isosorbide mononitrate topical preparations, ointment and transdermal patches. And number 4 is intravenous nitroglycerin. The organic nitrates. The nitrate preparations are relatively safe and effective against whose principal action in the treatment of congestive heart failure is reduction of left ventricular filling pressures. This preload reduction is due to an increase in peripheral venous capacitance. Nitrates will cause a decline in pulmonary and systemic vascular resistance, particularly at high doses. These drugs do have a selective vasodilator effect on the epicardial coronary vasculature and may enhance both systolic and diastolic ventricular function by increasing coronary diaphragm in which the nitroglycerin is present. There is a heart, which means which shows that the tunnel rat excavation bigger is better. We need to both this tunnel open and widen it for better access. Send up the nitroglycerin. Nitroglycerin widen up the heart muscle. Okay, quick and slow. Quick nitroglycerin involves the sublingual tablet and the translingual spray, while the slow release occurs in the nitro BID patch, nitro ointments, and the sustained release tablets. You can see the quick onset of occurs in 2 to 5 minutes of IV, while the slow onset of nitro occurs in 10 to 30 minutes of giving the TD or SL. Okay, sustained release tablets. Quick or slow release, watch out for severe hypotension. You have to check that it shouldn't be severe hypotension, it shouldn't be tachycardia, it shouldn't be dizziness, it shouldn't have headache and syncope. Okay. Hydralazine. The mechanism that underlie the vasodilator activity of hydralazine remains poorly understood. Hydralazine is an effective antihypertensive drug. In heart failure, hydralazine reduces right and left ventricular afterload by reducing pulmonary and systemic vascular resistance. This results in an augmentation of forward stroke volume and a reduction in ventricular systolic wall stress. Thank you.